Support for this work was provided by the New York State Health Foundation and Care Compass Network.
Thank you for joining us. In this segment, we hear from Sharon Chesna, Executive Director of Mothers and Babies Perinatal Network of South Central New York. There are several themes that Ms. Chesna focuses on, including the importance of strategic planning to organizations, embracing change, and the value of participation in relevant state associations and forums. Ms. Chesna describes how the participation of Mothers and Babies Perinatal Network in DSRIP, from the formation of Care Compass Network to the present, has resulted in organizational investment, growth, and diversification. Effective leadership and investment in administrative capacity to support the emerging value-based payment environment are key themes.
So Mothers and Babies Perinatal Network, we are a regional nonprofit organization based here in Binghamton, but we actually cover 8 counties in what we call the South Central New York region. Our organization has really been founded on serving those who are in Medicaid or those who are uninsured. So with the Medicaid Redesign Initiative and the DSRIP Initiative, we've been very involved, right from the very beginning with the grant process, as well as for the formation of all the various committees and components for the various programs that Care Compass, ended up identifying. As our organization, we have what we call our 4 core program areas. We have our perinatal services, our family support programs, teen pregnancy prevention programs, and our health insurance programs. So within each one, because most of those were all grounded in contracts from New York State, they all had, specific criteria for those grants. We also found that over the years, again, with our contracts, we'd be advised by, particularly the state, that we had to share all of our information and we had to put our data into a database, whether they contracted with a university or another research division or they created their own. And what we have found over the years is that those would come and go. So over the years, we have lost so much data because it was never our own. I think that as an organization, we have tried to make sure that we had as much comprehensive data as possible. We've been around a long time, and even, again, because our primary sources of funding and historic sources of funding have been contracts with New York State, particularly through the Department of Health and the Office of Children and Family Services, their expectations of what they wanted to see as far as demonstrating program effectiveness have changed over the years. In our early years, we were bean counting. We were counting the number of people we talked to, we were counting the number of brochures we distributed and the number of health fairs, if you will. We weren't really looking at outcomes for those individual clients we were serving. And then there was that shift to look at all that. So we tried diligently over the years to address those, and each change came with a bit of a struggle because we were used to the former process. And now that we have our electronic health record, we actually can do both. And it's also interesting to see that in some degree some of our state contracts have shifted backwards, and that they're more looking at, particularly because of evidence-based programming, they're looking at fidelity to curriculum, they're looking at demographics of clients that we're serving, and not necessarily, in a couple of them, as interested in the actual outcomes for the clients that we're serving. So it's very interesting to look back at the evolution and the expectations, of what our funders are looking for and how we can prove that to them. So we've tried very diligently over the years to comply with whatever the request has been, and I think now having the award system, it gives us just an incredible amount of data to look at in a variety of ways. All community organizations, first and foremost, have to think about what does their internal infrastructure look like. What capacities do they have, and how well are they aware of those? So for example, as an organization has grown, and we have grown particularly over the last couple of years because of our involvement with DSRIP, so we've had to make sure that we would shore up, let's say, our financial system so that we could appropriately, track and account for, resources that have come in, transitioning from a grant formula to a fee-based formula to potentially per patient per month, per client per month, a PMPM. All of those evolutions are really a financial piece that if we don't have a good handle on, we could quickly lose sight of, especially if we're not sure of what our costs are and we're in a PMPM situation. I think that every community-based organization needs to look at strategic planning, and they need to incorporate it on a regular basis. I will actually think back to the first time that I said to my board of directors, we need to conduct a strategic plan, and they went, okay, sure, go ahead. It was something that many of the board members themselves did not think about, did not really know how to do, and it was a struggle in the very beginning. I'm really proud to say that as a perinatal network and as a community-based organization, we have been conducting ongoing strategic planning for probably the last 20 years. We started out in the very beginning with a 5-year plan and then down to 3-year plans, and I think as everyone recognizes, things are evolving so quickly that you actually need to look at them all the time and they need to be massaged. That said, that's an overarching plan for our organization, and value-based payment, the transition in our healthcare system, is a piece of the current plan, which literally was just approved by our board last Wednesday. We'd been working on the revamping of our previous plan for the last 18 months, and so Wednesday was the culmination of the final presentation through the work of an ad hoc committee and a consultant as well as staff, so that we're ready to go. We're positioned and our strategies in there do include, continuing to build upon the relationships and the formalities of the relationships we now have with hospitals, healthcare systems, and our managed care plans, and that very much is a part of our plan for sustainability of the organization. So it will never be far from our sight as we move forward in the next 2 years. I think many of us as leaders of nonprofit organizations have, especially if anyone's been in their job for a while, recognizes that things are constantly changing. So whether they're used to foundation funding, government funding, those expectations are constantly changing. And I think what perhaps, and I'll throw back on the hospital systems, as we began the whole DSRIP initiative, I felt that the hospital systems were saying, we're going to help you, do your job better. I think that there are majority of nonprofits are doing their jobs very well. We are doing them very differently than a hospital system operates. So I think that if a nonprofit leader, is confident of the services that they're offering and knows where the changes are coming for them, then I think they'll do very well. We have to think about what is so exciting is the fact that for years now, we've all known that the work we do, now coined as our social determinants, are incredibly important for overall health and well-being and quality of life, for every individual and family. And now that's finally getting recognized. So being able to tell that story of what are those, services that you are providing that have a social and emotional impact for families, tell that story, and I think that we'll all do very well with the evolution in the healthcare.
Support for this work was provided by the New York State Health Foundation and Care Compass Network.